Good morning, everybody, everyone who's in the room and those that are watching virtually. I'm very excited to be here with you today. As Alex said, we at the Trauma Institute have been working with CHCANYS around this framework or organizational change framework called trauma-informed care for the last couple of years. And so certainly I've worked with probably about 15 of the health centers total so far in the context of that work. So I'm glad to be able to meet folks from other centers that we have not yet had the opportunity to say hello to, as well as other partners that are in the room. So when Alex had reached out to us and asked if we'd be willing to speak as part of this seminar, I thought a while about, what would be the most effective use of 45 minutes in terms of this overarching trauma-informed care framework, because there's a lot of things that in the spirit of today's theme of resilience and certainly attending to many of the things that Dr. Morrow even just spoke about, trauma-informed care fits in a lot of different ways. But what I ended up landing on was, based on taking a look at the agenda that you have today, you seemingly have many opportunities to hear about, to share about, to talk about different strategies, lessons learned, best practices when it comes to promoting resilience of the workforce, but certainly your health centers and organizations, right? And so trauma-informed care, trauma-informed practices really provides, a foundational framework to the approach that you take to the way that you respond. As an individual, as a health center, as an organization, as a system, right? Because what we do know about trauma, adversity, stress, loss, crisis, with this notion of resilience, is that if we're gonna be hopeful about responding in a way to be more helpful than hurtful, we need to at least neutralize the environment to make sure that we're not making it worse. And by doing so, we provide the opportunity for people to heal and grow. And so this trauma-informed approach, I'm going to invite you to take a step back for the next 40-ish minutes or so and think about, what is your approach right now to responding to whoever it is that you respond to in the context of your role. And my guess is you'll notice there are some things that I'll talk about that you're already doing to some extent or you're already thinking about. And there might be some other things that you notice, I could be a little bit more intentional about that, because it's easy to lose sight of some of these basic things that we know work when we're trying to respond to a crisis, right? And so that's what we'll be talking about today. So in the spirit of being trauma-informed, certainly we need to take a moment to acknowledge the here and now. One of the things that we continue to learn is that we can't change what's happening. We can't fix the fact that we are still in the pandemic, that we have things happening like Ukraine or the subway shooting a couple days ago, the fact that we're still managing and responding to lots of different things that are even outside the four walls, metaphorically, of your health centers and your organizations. And we know it impacts the people who come to work every day. We know it impacts the patients that show up for care. Right? And so our job as being trauma-informed leaders or trauma-informed organizations is not to fix it. It's about acknowledging and witnessing what is and responding in a way that at least does not re-trigger, re-traumatize, make it worse for folks. And by doing so, again, by using the framework that we'll talk about towards the end of my time today, we can promote environments, interactions that contribute to people's resilience building. Okay? So we're going to talk a little bit about the stress response. There's just a couple of key pieces that, if you're not familiar with trauma-informed care, it's helpful to know in terms of context. And then certainly I'll make some comment about trauma-informed leadership responses. And even if you're here not in a formal leadership role, certainly you're all informal leaders in the work that you do. And this is about the way that we interact with everybody, whether that's patients, community members, the workforce, your boss, right? And so we'll talk about that. Ooh, I went too far. All right, so for folks who maybe have heard of trauma-informed care, but you're not entirely sure what that means, these 3 bullets, even though there's no bullet points there, are really what it is that we're talking about, okay? So when an individual or a health center or an organization or a system is trauma-informed, it means that we have a solid, we have to be expert, but we have a solid understanding of how trauma impacts people. And certainly that means our patients and communities, but it means the workforce and possibly ourselves. We acknowledge the fact that people's past histories of trauma can be brought up in the present, in the here and now. And therefore, we intentionally do our work, whatever our work is, in a way that responds to intentionally prevent re-traumatization as best as we can. Okay? So again, it's not about fixing it or making it better. It's acknowledging the trauma, adversity, the stress, the loss, and how it impacts us. It's creating space to do that. It's recognizing that the way we choose to respond and the way we do our work can either escalate that and make that impact worse, or it can create environments where people begin to heal. Okay, so this is not about treating trauma necessarily. Some of your centers may have folks that do the trauma-specific treatment and the counseling. That's a very small piece of what we're talking about here. Today, specifically, we're focusing on this overarching umbrella, that this is the framework that guides everything we do, from intake to customer service to emergency preparedness to leading to fill in the blank. This is the way we do the work that we do that matters. So, I have a question for you. Folks, if you have a smartphone on you, and for folks online, certainly you could participate if you're watching live. You can either scan the QR code using your camera, or if you want to go to menti.com, you can put that code in. I'll give you a second to do that. And if you don't have a phone, no worries. I'll pull the question up so you can just reflect on it. All right, it's going to be 1 second here. So there's 2 questions for you that you'll be asked. And so on a scale from 1 to 10, with 10 being very well and 1 being not so well at all, the first question is, how well have you personally been navigating and managing these times? However you want to define that. How well have you been managing the last few years? Sorry, I'm not facing the microphone. And then the second question being, if you had to average out the folks that you work with, your health center or your organization, if you're not working in the health center, how well have others, do you think, been navigating, managing? Looks like both are averaging at about a 7. Okay. So thinking about being trauma-informed, it's about acknowledging, again, the adversity, the struggle, the deficiency, the loss, the trauma that may be contributing to putting those numbers at a 6.9 and 7. And it's also thinking about and noticing what is working that is helping you all and your colleagues and your centers be at a 6.9 and a 7 versus numbers lower. That's over halfway, right? Even in spite of everything that has happened, those are pretty high numbers. And so reflecting as I continue to talk and as you continue to have conversations today, what are the things that you already have in place for you personally to continue to show up and do what you do in a meaningful way, and for your centers to do the same? Because trauma-informed care is not asking us necessarily to do a whole bunch of things completely different. It's asking us to build on and notice what's already working, and certainly continue the conversation from there. So thank you. There will be one more poll question, so you can leave that out when we get there. All right, so let's get into it. If you take a look at this cartoon, anybody know anyone like this? See some smiles, maybe no hand raising, right? I bark at everything, can't go wrong that way, right? And so this is a cartoon from a book called Trauma Stewardship. It's certainly something I recommend checking out if you haven't heard of it before, right? But this is really speaking to the fact that, especially these days, right, we know that people are on edge, right, that people are activated, so to speak, because of the high levels of stress, adversity, crisis, loss that we're responding to, right? And again, we can't change that, but we can be intentional about noticing what that looks like and doing something possibly different in terms of our response, right? And so when it comes to being leaders, right, we have the opportunity at the Trauma Institute certainly to work with a couple of the health centers in the state, but also lots of other organizations from schools to mental health to, law enforcement, fill in the blank. And so, we've been capturing some of the narrative, if you will, in terms of what it is that certainly, again, informal, formal leaders are paying attention to across the board, right? And so you see things that are popping up here on the screen. All right, this is definitely not an exhaustive list by any means. But as you see these things coming up, I ask you to think about, again, your experience, what you've been paying attention to, what you continue to have to pay attention to. I see some heads nodding. This is a lot, and it's not even exhaustive, right, in terms of what it is that you have to pay attention to, some of which maybe you have a little control over responding to and doing something about, a lot of which you don't, right? And so, again, this framework that we're now going to start to get into and how is it that we pay attention to, this is the context in which you're doing your work. And so really, if nothing else that you take away from today, the key piece, especially being a leader in a trauma-informed organization or being a trauma-informed leader, is how is it that you create space? And that could be sending a memo, that could be making a statement at a meeting, that could be, spending some extended time meeting with someone to acknowledge and witness what is for yourselves and for those that you work with. You're all very busy people. It's easy to go from one thing to the next. But whether we pay attention to these things or not, the body keeps the score. And so if we create space, there's opportunity to do something with it. All right, so a couple key concepts. Not going to spend a lot of time on these pieces here that I think are helpful in terms of, again, understanding why this trauma-informed framework and approach works. And then we'll talk about, so what is it that we can actually do, Samantha? So what we know is that by age 10, kids have a pretty good sense of themselves versus other people. This notion or core beliefs that we all have, we all come to this present moment with in terms of how we think and feel about ourselves, other people, and the world as a whole, is called self and worldview. And what we know is that those beliefs, those core beliefs that all of us have, are shaped by our previous experiences. And so from a trauma-informed perspective, it's important to acknowledge this because in the here and now, we each come to our work, or patients come to receive care, and they have their self and worldview that influences how they perceive the here and now. So I have glasses on. I think about self and worldview as glasses, right? It's the filter through which I'm perceiving right now. We're all in this room together, except for those of you who are virtually, right? You're listening to me talk, and you're all thinking about and perceiving this here and now moment differently based on that lens. And when that lens is shaped by trauma, adversity, crisis, loss, we do know that those beliefs tend to be more on the negative side in terms of I can't trust you, people will hurt me, I can't control what's going to happen to me, I'm worthless, helpless, right? And those types of things show up in the here and now. And so again, as a trauma-informed leader, we can't change what people are coming in with, right? But we can recognize that the way that we do our work in the here and now is going to be perceived through this filter. And there are ways that we can be intentional about not unintentionally bringing up those pieces, right, for our staff and for the patients. The other thing that we know, though, is that certainly the brain continues to develop over time, right? And that 10 is when those core beliefs are formulated. But there are things called significant emotional events that continue to shape that sense of self, others in the world, right? And so certainly thinking about COVID, thinking about the veil being lifted differently, I suppose, even though it's been something we've been managing for lots and lots of years around civil social unrest, right? Adding on the layers of Ukraine and different things, right? We know that people have been experiencing this fracture, if you will, because of the common denominator of loss, right? Whether that's loss of loved ones, loss of life in general, loss of normalcy, safety, you see the things there, right? And so again, I'm just putting a name to, we know this is the state of where people are coming from, and that includes you in the workforce, right? And especially when you're in a role like healthcare, right? When you show up every day to attend to other people, right? You see the words on the right-hand side of the screen here, right? And some of these you might be familiar with: decision fatigue, moral distress, secondary traumatic stress, vicarious trauma, burnout, compassion fatigue, right? That when you're attending to others and you're doing your work with a little bit of an open heart and you're being present to adversity, trauma, loss, crisis, we're at risk of being impacted by that. And so as a leader, thinking about how is it that I can best support the workforce and support the center's functioning, how are we attending to these terms? Do you know what these things are and what they look like for yourself, for your others? Are there conversations about these things happening at your health centers and your organizations? Are there spaces to normalize these reactions and talk about what is it that can be done to respond? Right? That's part of the conversation that we don't have time for today, right? But acknowledging these pieces is part of what it is that we're attending to. Last piece in terms of contextualizing before we get into what is it that we can do. What we know is that our brain has a stress response. Many of you, all of you are probably familiar with fight, flight, and freeze, right? In terms of going back to school days, what happens when we're, walking in a forest and there's a bear, right? That your amygdala sends off the alarm saying, hey, there's a threat, right? And you need to get ready to either fight the threat, run away, or freeze, right? And so very quickly, Dr. Dan Siegel has created what he calls the hand model of the brain. I think it's a useful visual for any of us to think about, what might be happening for folks in the here and now and how we can respond. All right, so folks in the room, if you wouldn't mind humoring me and just holding your hand out like this, please. So Dan Siegel says this is the brain, right? If you fold your thumb over the palm of your hand, that represents the amygdala. Again, one of its core functions is to, every few seconds, scan the environment looking for any sign of threat, right? For folks who have histories of trauma even prior to the here and now, this tends to be overactive and can be actually larger than folks who have not, just side note. Folding your fingers over your thumb, that represents cortex, specifically prefrontal cortex, which allows us to make decisions, to engage in conversations, to process oral information, to think ahead, all that good stuff that we need to do in our roles, right? And so what ends up happening when the amygdala detects the threat, and by the way, your brain responds to real and perceived threats in the exact same way. The amygdala starts to fire until finally it can't hold on anymore. And so if you've heard the expression, someone's flipped their lid, all right, thank you, you can put your hands down, right? So when the lid is flipped, right, this part of the brain goes offline. It's an adaptive survival response, because if you're in the woods and you see a bear, and if you're full-brained and your prefrontal's in charge, you're gonna be like, I wonder what kind of bear that is, and what kind of food do they eat? And no, the lid flips because you get ready to fight the bear. Probably not super helpful. Run from the bear or freeze, right? And so that's great when you're in a forest and there's a bear. The problem is that the bear, metaphorically, is continuously around us all the time based on what is happening, all right? The bear comes to work with us. It comes to the patient appointment with the patient, right? And so we know people are in this flip-flip state, more so than ever. This is obviously a conversation that was relevant before COVID, et cetera, right? But more so than ever, right? Similar to that dog about I bark at everything, right? That means the lid's flipped. When people are in a flip lid state of mind, they're not concerned with all of the, all right, let's be planful, let's talk about what makes sense, let's strategize, right? You're very reactive. And people are usually irritable, quick to emotion, making mistakes, not thinking things through. I guess as all of us have been in that state at some point in the last couple of years, right? But this is how the workforce is, based on what we've been hearing from folks, what we're seeing, maybe not all the time, right? But when people are in this flip lid state, it's really challenging for people to stay regulated enough, right, to do the work that they need to do, especially in a way that's patient-centered, right, especially in a way that's going to promote resilience, right? And so really our job as being trauma-informed is how do we help the lid come down as best as we can, as well as how do we prevent unintentional lid flipping, Okay, this is very simplistic the way I'm putting it, but this is really the role of trauma-informed care. It's recognizing when people's lids are flipped, including our own, and therefore responding intentionally to help the lid come down. Okay? And so as a leader, and as really anybody, right? And there's lots of words here. You can take a look at this on the slides when you get them later on, but this is from the Colorado Healthcare Ethics Resource, is recognizing where am I at any given point during the day. Because the reality is, as much as we want to be in the blue column in terms of thriving and at our best in terms of we're regulated enough, we can be flexible, we can do what we need to do, we're probably more so in the middle two columns, possibly finding ourselves in the right-hand piece, right? And so recognizing that where you are today at 9:55 might look very different than 12:30, might look very different than 5 p.m., et cetera. And so again, creating that space to take pause and notice for yourselves, but certainly for the folks that you are working with. But especially for those of you who are in formal leadership positions. Because what we know is that states of functioning, meaning full brain versus flip lid, are contagious. Right? We have neurons in our brain that are called mirror neurons. I'm kind of a brain science geek. That really have the sole purpose, if you will, of monitoring what other people's emotions are and then mirroring them in ourselves. And this is especially true when there's any level of a power dynamic. So whether that's leadership to staff, whether that's a provider to a patient coming in or a staff member to a patient coming in. And so what this means is that even if somebody comes into an interaction with you and their lid's flipped, has nothing to do with you, who knows what happened before they got to you, right? That if you're able to maintain your state of calm, if you will, or be regulated, emotionally regulated, you're paying attention to your tone of voice, your body language, you're using language that's not, threatening, those kinds of things, that eventually they will come down to mirror you. It might take some time, it may not be instantaneously, right? But that's an important tool that just simply by your presence, being calm and regulated enough that you can influence the people around you. But the opposite is also true. If your lid is flipped, as a leader, which happens because we're all human, you are likely to flip the lids of people around you based on this concept of emotional contagion is what Dr. Bruce Perry calls it. And so what is it that you are doing for yourself, first and foremost, before you even think about your organization, to keep yourself regulated enough? How do you show up to work every day at least somewhat full-brained? You may not be able to be totally, because it's just, we're humans, right? We have stuff that happens too. But if you're walking into work with your lid flipped, any of the strategies, conversations that you're talking about today are not going to be effective because you're going to set off the people around you. And that's pressure, right? In terms of being a leader. And so asking yourself, what do you do for yourself? What do you need for yourself in order to keep going, right? And so I just ask you to think about the here and now before we transition into this, what do we do here? All right, thinking about yourself, thinking about the workforce, patients, your health center, your organization, the community as a whole. All right, and especially with the workforce, we have another cartoon, right? It says, we just haven't been flapping them hard enough. And penguins can't fly, just FYI. Right? All right, we know that dysregulation is present. Flip lids are happening. We know things that are taking longer than perhaps that they used to as a result of that. We know that there's an increased need for flexibility and support. We know that priorities are likely going to continue to change, right? And we know that we are in a state of being, because of the activation, that we have to focus on short-term goals while thinking about the bigger picture, right? And so this might feel a little bit like this for folks, right? Again, all of the things that you're paying attention to and need to happen. And really, from a leadership perspective, the conversation we often have is how is it that we can be trauma-informed and provide support and be flexible and acknowledge what's happening for the workforce, and yet our centers still need to function. We still have to show up and do what we need to do every day. We still have patients to see. We still have things that need to be done. And so how in the world do we balance that? Right? And I was going to ask you that question, but for the sake of time, we're going to continue forward so we can make sure we get into this piece. And so the short piece here in terms of thinking about what is it that we can start to do even today, and you're doing some of this already, is being intentional about the way that you respond and the way that you interact with the people that you interact with. If you have decision-making around policies or procedures, or you have decision-making around a communication or a memo that you're sending out, or you're leading a staff meeting, or you're leading whatever it is that you're doing, if you can be intentional around anchoring yourself about the way that you do it, so I'm not even asking you to take more time necessarily out of what it is that you're already doing, it's paying attention to the way, because we do know that it matters how we respond. So this might be a little bit challenging to see, and certainly we can give you this as a handout too. I can send it to Alex later. But at the end of the day, again, we can't control the fact, and I've said this 8 times, but I really want to hammer this home, that people are coming into our centers and our organizations with trauma, whether it's past trauma or it's the current traumas that are resulting from what's happening right now. But this is the work in terms of this is something that we actually do have some control over. This notion of what is called re-traumatization, which means that in the here and now, somebody comes into the interaction full-brained, and because of something out here, whether it's the situation, what we're asking them to do, your tone, your body language, the interaction, causes the lid to flip, right? So being triggered, re-traumatized, it's the same kind of language that we're using here, right? And so what we do know is that there are ways that our systems are set up, sometimes ways that our interactions end up playing out that unintentionally cause that lid flipping to happen. And so what this chart is depicting is that you don't even have to know people's trauma histories necessarily to know how to prevent this from happening, because there are common trauma themes or dynamics that almost regardless of the details, that these are things that we know reasonably are going to flip people's lids, right? And so on the left-hand side, you have system, organizational dynamics, right, that are usually around policies, procedures, absolutely acknowledging the context of institutional racism, oppression, discrimination, right? And on the right-hand side, there are relationship dynamics. And so it's being honest with yourself as an individual, and certainly if you're in the position of thinking about your health center as a whole or your organization as a whole, is it possible that the way we do whatever it is, again, intake, the way we see patients in the 10 minutes that we have, and the way that we run our staff meeting, and the way that we think about emergency preparedness, whatever the conversation is it possible that somebody or somebodies will experience not having choice in the process? That will experience as the workforce that, hey, we're not being acknowledged in terms of the stress that's going on right now. That there's accessibility challenges, right? That there's isolation or exclusion practices happening, right? That maybe we're doing things for or to people because we don't have time and it's easier than taking the time to stop and do it with them. That we're not acknowledging the larger historical community narratives that are influencing what it is that we're making decisions around, right? That there are microaggressions happening in the workplace, right? So you can see, I'm not going to read these all to you. This is not an exhaustive list, but there's 22 things on here, right? And so there's a little bit of an ouch factor with this sometimes, right? That sometimes things are in place because it's the way we've always done it, or things are in place because that's what has to happen based on mandates or capacity or whatever it is, right? And so trauma-informed care is not necessarily saying we can or can't do things, right? It's just inviting you to think about the way that you do them, right? And so the way that we are able to influence that is by using our trauma-informed values and principles, which we'll talk about here in a second, right? And so being in healthcare, right, I think hopefully you'll appreciate this universal precaution analogy, right? So similar to how providers, right, you put on gloves when you come in contact with any kind of body fluid, right? You don't ask people, like, do you have this infection? Right, you just put on gloves. Trauma-informed practices is metaphorically asking us to put gloves on in terms of we are just assuming everybody we come in contact with, everybody that our health center interacts with has a history of trauma, and therefore we're going to purposely respond to everybody in a trauma-informed way, because it's not going to hurt people who have not experienced trauma. And the reality is we're really in a time frame where people are still experiencing heightened adversity, stress, even if they're not experiencing it as trauma, right? And so that's, again, responding in a way that helps the lid come down, right? Universal precaution, gloves on. Because what we do know is that when we are intentional about engaging in universal precaution for trauma, and by trauma, I mean more than individuals' trauma, right? It's that we need to be paying attention to the fact that there's historical trauma, there's systemic trauma, there's racial trauma, there's inequities, right? The conversations that we've been having already since this morning, right? And by engaging in the values and principles that we'll spend the last couple minutes talking about here of safety, trustworthiness, choice, collaboration, empowerment, this is what's possible, right? And you see your resilience word is at the top there, right? That when we are intentional about utilizing these things, it is possible to create environments, cultures, climates in our organizations, in the community that contribute to healing, resilience, equity. You can see the pieces there. This is what's possible. And you're already engaging in some of these practices. I guarantee it. I don't know most of you in this room, and I guarantee you're already doing some of this already. And so now I'm going to ask you to pull the handout out that's in your folder. For those online, it says Trauma-Informed Leadership Responses. This is a one-page checklist. Before we even get to that. So again, how we engage in universal precaution, how we put the metaphorical gloves on, how we think about the overarching umbrella to the way that we do our work is basically this sheet. Now, this is at an individual level. It's not getting into all the organizational weeds that we don't have time to get into today. But thinking about you and your role as you are today, whoever you interact with, even if it's, again, you're not in a formal leadership position, that you have capacity to do at least some of these check boxes in your interactions with others, right? And so you can see here that we're paying attention to physical and emotional safety, right, by doing things like what we've already talked about, openly acknowledging what is, modeling and encouraging regulation, so being regulated yourself, right, being intentional about being visible and present to the people that you work with, right? How is it that we focus on that relationship piece in terms of, even if it's only a couple of minutes, could be 2 or 3 minutes, to focus on checking in with somebody as a person first before getting into all the details of what needs to happen, right? How is it that we promote trustworthiness by being clear around what is expected, what they can expect from you or the situation? There's a lot of things we can't predict, but there are a lot of things that reasonably we know are going to happen in terms of our dailiness of our health centers and organizations. And so how do we let folks know what's going to happen, when, under what circumstances, by whom, right, ahead of time as best as we can? And if there's going to be changes, how do we let people know as soon as we know? And how do we be willing to be in the spot of saying, well, we don't have the answer to that right now, but we'll let you know when we do, right, in terms of that open communication, right? How is it that when we recognize people are in a flip-lid state, we need to keep our communication style simple and concrete? Because when the brain is not working so well in terms of altogether, it's hard to process that oral information. How do we give people choices and options? Even if the parameters are this tiny, right, in terms of sometimes there's not a lot of wiggle room, or sometimes there's really not a lot of options. Like, do we take some intentional time, even if it's 30 seconds, to say, all right, what is the option here? And sometimes the option is this is what we need to do, or this is the consequence, right? I mean, that is a choice that people can engage in, right? How is it that we model the model of focusing on what we do have some control over? And so when you have staff meetings and when you're in conversations with people, do you spend more than 10% of that time talking about things that you have no control over? And if you do, inviting you to think about, maybe changing that ratio a little bit. All right, collaboration, we already heard from the previous presentation in terms of people are the expert of their own experience, whether that's them as a patient or your workforce and their roles, or any of you in your roles. And so how are we building on what people know to be true, what people have learned, right, to work towards where it is that we're going? And then empowerment, right? And I really think about this for folks in the room. If you just look around the room for 5 things that are blue. Once you got some, you can look back up at me. Everybody got some? All right, without looking around, what orange things did you see? So you might be able to tell me something, but my guess is that you were so busy looking for blue, you weren't necessarily paying attention to the other colors in the room. All right, what we focus on gets bigger. And so I invite you to notice, what is it that you focus your attention on? We live in a very problem-focused world. Certainly healthcare is set up to be, what's the problem, how do we fix it? All right, but when we focus on problems, what do we see? problems. Not that there's not time for problem solving, because we need to do that. And how do you also make time to notice what is working, what doesn't need to change? What strengths and capacities the situation, the team, the organization has that we can utilize to then address the problem, okay? So we only have a couple of minutes left, but if you would please, just with the people at your table, and for those of you online, you can just kind of reflect to yourselves. Looking at this checklist and just taking an initial scan, thinking about your role, which of these boxes can you check already? In terms of how do you do some of this already, what does it look like? And based on today's conversation and looking at this, is there anything, I could be a little bit more intentional about? Okay, so just take like 3-4 minutes to talk with the person next to you, and then we'll come back together to wrap up. All right, so I know there wasn't a ton of time. I just want to be mindful of the rest of your agenda. So I invite you, as you continue to have conversations today with the other presenters and the other sharing and strategizing that you're going to discuss, and certainly as you go back today to your roles, that again, these types of things, even though they may seem simple and it might be like, well, duh, Samantha, these things make sense, right? These aren't things that we oftentimes are very intentional about. And so again, this is what neutralizes the environment. Doesn't fix all the things that are happening, but it at least is when our workforce and when patients come into the walls of our center, our organization, when we engage in ways that do this, we are able to respond to lids that are already flipped and help them come down, as well as keep them down proactively and not unintentionally activating them. And so as you continue your day today and continue to have conversations, all right, I invite you to notice some of these summarizing pieces here in terms of what's already working. So thinking about those lessons learned, right? How is it that, again, you can create any level of space to acknowledge the here and now, providing space for connection because relationship does matter, right? Getting input and feedback from those that you work with, right? Again, people are the experts of their roles and are also able to notice what's working, what's not working, right? Making sure that you are both modeling and communicating your expectation around wellness and regulation and providing opportunities for that to happen at work, even if it's just 2 minutes at a time, right? Remembering the locus of control piece, 10% or less on things that we don't have control over, right? And as you can see as the highlighted piece, this all starts with you in terms of leaders and making sure that you prioritize time for your own support and wellness because it's going to reverberate throughout the rest of the organization, okay? We don't have time for this clip. Certainly you can take a look at it. Ooh, I don't know why the colors didn't all show up. But I'll leave you with this from Brene Brown. Hurt is hurt, and every time we honor our own struggle and the struggle of others by responding with empathy, the healing that results affects us all. And so remembering, how is it, if nothing else that you take away from my section of this day, that you can be in a position of acknowledging, witnessing, validating, and being present. So thank you.